A very good afternoon to everyone joining today's webinar. I am Dibanjali. You can also call me Debs. I'm a technical evangelist at Manage Engine. As you can see, today we have a very critical topic in hand, which is why healthcare organizations need modern IAM solutions or sophisticated IAM solutions. So, we have seen that the number of cyber attacks on healthcare organizations has been increasingly drastically over the last few years, and unlike other attacks or other data breaches, which only has an impact on the revenue or the reputation of the organization, attacks targeted at healthcare organizations can actually put human lives at risk. And to avoid this, healthcare organizations need to increase their spending on IM or cybersecurity and stay ahead of these attacks. So, we'll quickly start off. We'll take a look at the increasing complexity of attacks in the healthcare sector and what leads to these attacks. We'll also see the consequences, and then we'll discuss why legacy IM solutions are becoming obsolete and why they can no longer protect organizations using them against complex attacks. Once we've seen why legacy IM solutions are no longer adequate, we'll discuss why healthcare organizations require sophisticated IM solutions and what are the capabilities you should look out for while evaluating IM solutions for healthcare organization. And we'll see how privacy regulations such as HIPAA affect the choice of an IM solution, and how Manage Engine's IM solution AD360 can help secure healthcare organization against cyber attacks. Now, as I have mentioned earlier, that the frequency, the complexity of attacks targeted at healthcare organizations is constantly increasing. And in a recent study, we've seen that the number of ransomware attacks on healthcare organizations increased by 94% from 2021 to 2022. So we can see that there is a huge surge in these attacks during the COVID-19 pandemic in 2020, because attackers exploited healthcare organizations, their limited resources. They were trying to take advantage of this situation to gain access to sensitive records, cause data breaches, and whatnot. One such example from the top of my mind is United Health Services, UHS. It has almost more than 400 facilities. It has 3.5 million patients across the United States and United Kingdom, and they were the unfortunate victim of one of 2020's most damaging ransomware attacks on the healthcare industry. Uh, Most likely, it started with a phishing email, although there was no indication of leaked data. But the incident cost the company $67 million dollars in recovery expenses, labor costs, and lost revenues. So, to be honest, the attackers had entirely crippled the organization's IT network in the US for several days in September, and the staff, the employees, they had to resort to offline processes, including paper records, and needing to redirect patients to other providers or cancel appointments. So it took nearly a month for UHS to completely restore its system. So, I think from this example, we can understand that when cyber attacks take place on the healthcare sector, they are much more complex and the consequences are much more damaging. So, healthcare providers and other organizations in the healthcare sectors have limited budgets to spend on cybersecurity, which is why there's a poor security posture. So, hospitals typically only spend 5% of their overall IT budget towards cybersecurity, and healthcare organizations that do not allocate budget towards improving their IAM and cybersecurity frameworks are more vulnerable to data breaches or cyber attacks, and later on, all of this proves to be much more costly. So, these organizations need to have the right technology in place. They should leverage industry best practices, but this is not something that all organizations in the healthcare sector focus on, and this is one of the major reasons for the increase in such attacks. So, healthcare organizations, they also possess the risk of having an increased attack surface due to the large number of devices used for medical purposes. So, when these devices are left unsecured, the attack surface increases, and the increase in attack surface is also due to the transition from physical records to electronic health records of patients. So, this attack surface only increases with the increase in number of healthcare providers and other organizations in the healthcare sector. And all of this makes healthcare industry an easy prey to attackers. Now, like I mentioned earlier, healthcare organizations do not spend much on improving their security posture and staying up to date with the latest technology. A lot of organizations still use legacy IM systems which are outdated. They cannot tackle complicated attacks. But as much as these organizations stay on top of the latest medical equipments and technology, they fall behind when it comes to spending on cybersecurity or IM, which makes it easier for attackers to exploit vulnerabilities in the network and launch successful cyber attacks. So one thing which is very clear from all of this is the increasing value of private patient information is one of the most important reasons driving attackers or hackers to target healthcare providers. So each stolen medical record is known to fetch anywhere between $50 to $20,000. So besides this, hackers also steal patients' medical records. They create identity kits, which are again used to create fake IDs, file false insurance claims, and all other sort of scams. So these identity kits are valued at an average of $2,000. So, as you can see, that the value of patient data keeps increasing. Therefore, the number of attacks and data breaches targeted at healthcare organization is also bound to increase. One of the major consequences of these attacks is the breach in patients' trust and confidentiality. So, this is also in violation of privacy regulations such as HIPAA, high tech, GDPR. And when it comes to healthcare organizations, the most serious damage that can be caused due to these attacks is the fact that people's lives may be impacted. When critical medical devices are hacked, it puts the lives of patients who are dependent on them at risk. And finally, all of this leads to heavy financial losses and negatively impacts the reputation of the hospital or the organization. Now, we've been discussing this for over a year now, why legacy IM solutions are becoming inadequate. Perimeter based legacy IM solutions are vulnerable to insider threats or insider attacks because they focus on securing only the network perimeter and they keep out external attackers. So, in these systems, trust is binary, which means everything inside the network is trusted by default and anything outside the network perimeter is not trusted. So this leaves insider threats unchecked, leaving the network vulnerable to insider threats and attacks, and rest is history. Legacy IM solutions, they also have reduced visibility over resources because the network is not monitored continuously. Users and entities are given access to the network only upon successful authentication, but they're not monitored continuously once they are within the network, which is why anything and everything that happens after successful authentication, if there is a deviation in their behavioral pattern, they become malicious. There's nothing that we can do about it because all of these users or entities, they're not monitored regularly. One of the major drawbacks of legacy IM solutions is their lack of support for remote access or cloud based applications because once we've shifted to remote work or hybrid work, Legacy IAM solutions that do not support cloud hosted applications, they're practically obsolete. They're no longer adequate in this current cybersecurity landscape. So, legacy IAM solutions, they offer only single factor authentication, which is not as competent as multi factor authentication because the authentication methods supported by legacy solutions are very outdated. They cannot be used to secure healthcare organizations which hold sensitive data or critical data. So, in hospitals, doctors, nurses, and other people associated to healthcare organization are not in this mindset because to them security measures are something to work around and find shortcuts because they stand in their way. So it is in a medical professional's nature to find the quickest way to deliver care to a patient, especially in an urgent setting like the emergency room. Therefore, implementing a digital identity framework that takes care of the uniqueness of the healthcare industry is critical while you're integrating compliance or security into the end user workflows. So security has to be built into the technology a hospital uses, and security features that are add-ons can lack the seamless functionality required for tight cybersecurity defenses, which is why it is all the more important for healthcare organizations to adopt modern IAM solutions, which will also provide them seamless experience apart from tighter security defenses. So SSO and MFA, they allow medical professionals to access applications and devices with a badge tap or a fingerprint or any other biometric, so we can avoid the long and tedious process that takes away from these professionals time to give patients the care they need. And even with strong passwords, hackers primarily use passwords to get access to sensitive information. That's why it's important to pair the password management functions of SSO with MFA to give healthcare organizations that extra layer of security. What makes the combination of SSO and MFA great is that it keeps things less complex but still delivers cyber protection. So it's a win win for healthcare organizations as they balance security and workflow efficiency. So, healthcare organizations can actually face severe penalties for failing to comply with regulations such as HIPAA or high tech or GDPR. So, controlling privileged access is a key component of the expected security measures. And since in healthcare organizations, the number of users or the nature of users is very distributed, therefore, it makes it very difficult to effectively manage and monitor them. So, the larger or the more complex the system becomes, the more privileged users are required. So, securing privileged accounts will allow healthcare organizations to proactively protect themselves, and controlling privileged access will limit the moves of an hacker after they've established a foothold in the network. So, this will greatly diminish their ability to move laterally within that network and access sensitive system. So, with the right privileged access security steps in place, a hacker's capacity to escalate privileges and access confidential information such as patient records will be greatly prevented. And when the behavior of privileged users is monitored and managed by a privileged access management system or a PAM system, health organizations data becomes more secure. That's why PAM needs to become a priority so that you can assign only the required level of access to a patient's health information to doctors or nurses or health insurance executives, or basically who are directly responsible for that patient. Now, with privileged access management, if you can tie in multi factor authentication, you can basically manage identities directly to privileged account use. So, even if credentials are stolen or shared, unauthorized users cannot leverage them for privileged access entry. MFA will check identities at all major access gates, including machine login or VPN login or privilege elevation for an added layer of identity assurance. Now, for many healthcare organizations, IAM still boils down to a set of technical, administrator driven capabilities managed by native tools. But legacy approaches such as using scripts to provision new users to the Active Directory, they're not only difficult to maintain but can also lead to delays and errors in onboarding and offboarding. So, hospitals, particularly teaching hospitals, they need to manage multiple HR sources. There are staff, there's doctors, contractors, individuals with multiple personas in that particular organization. So, there's multiple identity life cycles based on organizational relationship. Now, in a teaching hospital, a physician might be a faculty member at the university while they're also being on the hospital's payroll as a researcher. Staff might be employed both at the customer hospital or another facility. So all this while, healthcare organizations, they had been using manual systems to manage these complex access and identities, but this left the door open for error, and sometimes access wasn't expired correctly. Different people were creating identities in different places, and these accounts didn't always line up. Now, in order to ensure HIPAA compliance, we need to stop conducting inconsistent or error prone manual processes. So, this is why we need to automate identity lifecycle management. So, identity lifecycle management solutions will help healthcare organizations overcome these challenges by automating manually intensive or error prone user provisioning and identity governance processes. They can help improve employee productivity by allowing new hires to hit the ground running with day one access to their applications or IT services. They will help businesses reduce security risks by eliminating privilege creep and out of date user accounts. And they can help IT and security organizations free up staff to focus on much more important tasks to support the business. As we all know, regulatory demands for the healthcare industry, they're very rigid, they're very demanding, and there's practically no room for error when it comes to healthcare data. Now, but disasters can strike anytime. They can strike in a variety of ways. Just think of natural disasters or power outages or global pandemic last year. The best way to deal with these scenarios is to have a backup and disaster recovery plan set in place before they even occur. So, healthcare organizations in particular must ensure their data is backed up safely and securely, and that it can be recovered and accessed quickly so that operations can continue. After all, in the healthcare sector, time is critical due to accessing patients' information and treating them quickly. Health organizations cannot afford to lose time when patients need to be quickly diagnosed and treated, so data theft or loss can result in increased patient deaths. So, having backups and that can be recovered quickly and efficiently is essential to providing timely care to patients. This way, operations will continue even after the organization is struck by a cyber attack or any other disaster. Now, another critical factor to consider here is how easily employees can use a data backup and recovery solution to verify the state of the backups at any time. Medical data is constantly growing at a fast pace, so backups must be updated regularly. After all, what good is the backed up data if it's obsolete? So, this medical data has to be backed up regularly at specific internals. So, sophisticated data backup and recovery solution should be able to do that. Now, given that healthcare is one of the most complex and highly regulated industries, the government's regulatory steps, they constantly evolve and they require healthcare organizations to develop with them. But to do so, compliance programs must include constant monitoring or auditing so that they can resolve issues quickly and appropriately as they arise. So, auditing and monitoring are the most critical elements of healthcare compliance, because they evaluate whether internal controls are adequate, whether they are productive. So auditing tools or healthcare compliance solutions, they simplify the entire process. They keep all the data in one central location, so the auditing tool makes it easy to identify these high risk areas, and organizations can then run risk assessments. They can find gaps in compliance, and they can quickly address these potential risks before they go out of hand. So guarding against this unauthorized access to patient data, or monitoring the file owner and permission changes, or getting the information such as before and after values of permission changes and alerts upon suspicious logons. All of this, when you have pre-configured reports populating all of this data, so that you can quickly take a look at it and find out if there are any errors and quickly address those changes. This makes it easier for healthcare organizations to be audit ready and to be compliant. Now, Manage Engine's IAM solution 8360 can help in a lot of ways in terms of HIPAA compliance, in terms of protecting healthcare medical data, or as a whole protecting the healthcare organization. Manage Engine 8360 can help. I'm going to go ahead and discuss a couple of capabilities of Manage Engine's 8360 solution, which can help healthcare organizations or help IT administrators of the healthcare organizations do their job better. So, with AD Manager Plus, it's a module of our 8360 IM solution. You can have a complete audit trail of all the users who have logged on in the last n number of days, or you can view users whose recent logon attempts failed, or you can check users real last logon times and the recently modified GPOs. You can identify users who haven't changed their passwords recently. So all of these informations you can find as reports or pre-configured reports in real time. So it really helps in simplifying your audit process and to pull up these reports when you are in a compliance audit. So apart from all of these monitoring changes, you can also simplify a lot of routine tasks such as provisioning users or cleaning up dormant accounts. You can manage NTFS permissions or share permissions, because AD Manager Plus, it offers more than 150 pre-packaged reports, and you can perform the management actions right from the reports. You can build a custom workflow structure which will help you with ticketing and compliance, and you can automate your routine tasks so that you can avoid manual errors, and the entire process is error free. Now, enforcing fine grained password policies for organizational units, groups, and implementing stringent password policy for privileged users who have access to PHI. All of this is very, very important. We have to prevent users from setting passwords that are dictionary words, or that are easy to crack patterns or passwords, or that have been compromised due to data breaches. All of these measures need to be taken to ensure that your medical data is safe, and that only users who have the right access to resources or machines or critical systems are the ones who are getting access, and all unauthorized access can be prevented. To do so, we can enforce multi factor authentication for different users based on domain or organizational units, group memberships, all while ensuring a seamless login experience. Now, in order to ensure business continuity during a disaster or during an attack, touchwood, I hope that situation never occurs, but we never know. We need to be able to recover instantly from cyber attacks by rolling back your entire Active Directory or a few organizational units or even individual objects to a previous backup point, and undo all changes made to objects after that point in time. So, as I had mentioned earlier, it is not just about backing up your data. we should be able to back up data in real time, so you can schedule backups to happen automatically at regular intervals without any human intervention. So, as the healthcare industry continues to rely on internet or internet connected technology, maintaining cybersecurity and the necessary preventative measures to remain HIPAA compliant, it becomes increasingly difficult. But Manage Engine can help improve the cyber health of your entire ecosystem, as well as identify or monitor or manage third party risk, all while staying alert to patient privacy and health provider infrastructure needs. Now, as cyber attacks continue to become more sophisticated, it is important to continuously monitor your cybersecurity posture, take control of third party risk, and ensure compliance with regulations such as HIPAA, high-tech GDPR in order to protect your sensitive health information from leaving your network. Thank you everyone for joining today. If you want to know more about the solutions I spoke about in the webinar, which is 8360, AD Manager Plus, AD Self Service Plus, which takes care of multi factor authentication, SSO, Password Policy Enforcer, you can just write to me. For compliance and auditing needs, we have AD Audit Plus, which has almost 700 pre configured reports. And all of this can help you make the cybersecurity posture of the organization much better. So you can write to me at debs at managengine.com, and I'll be very happy to help you get a demo of any one of the solution, or you can just simply write to me. We can have a casual discussion on what kind of requirements you need to take care of. Thank you so much again for joining. I hope all of you have a very lovely day.